Good. Okay, yes. Start it, and here is your question.
Okay.
Right. So if you have read and understood, considering the clinical examination station, kindly begin.
Yes. I'll enter the room, wash my hands. Good evening. I'm Dr. Kolade. I want to examine you. Can I know your name and age, please?
Nikina Max, 33 years old.
Okay. I'm one of the doctors here. I've been asked to examine your right shoulder.
Yes.
But I will examine both shoulders. Hope you agree that I can go ahead with it.
Yes.
Okay. So I will need to expose you. So you need to take off your gown.
Yes.
So that I expose both your shoulder, your upper limbs, both your hands above, then down to your nipple. Then you can wear your bra. No problem with that.
Okay.
So so for the examination, you need to stand up. So I'll examine you. Please, at any time if you have pain during the examination, kindly let me know so that we can give an analgesic. Hope no pain now.
No.
Hope you don't have any pain now.
No.
So I will stand in front of the patient. I will look at, after exposing, I will look at the shoulder from the sternoclavicular joint down to around this elbow, and also look at the lateral side and then also at the back. I'll be looking out for any scar, any sign or any swelling, and then there's also any deformity. I'll be comparing the right with the left. So after observation, then if I notice any of those signs are to be noted, then I will also examine for differential warmth from normal, abnormal to normal, and then I will now check for tenderness. While checking for tenderness, I was looking at the patient's face. I'll start examining for the tenderness from the sternoclavicular joints to through the clavicle, then check all over the acromion, the acromioclavicular joint, the coronary process, then around the shoulder, and then go back to press along the spine of the clavicular, of the scapula, and then the supra and the infra scapular fossa if she has pain at any of those points. So after checking for that, I want to examine her for the range of motion I will first ask her to do. I will be checking for examination I'll just ask her to do active first. So to flex, extend the shoulder, internal and external rotate it, and then also to perform circumduction. After she has done the active one, then I will do the passive one myself, noting the angles at both the active and the passive motion that she's able to do. Then after this, I will now check for the muscles that make up the rotator cuff muscle to check if any of them is injured because of our complaints and then having work overhead. So to check for the supraspinatus, I will do the empty can sign. I will ask her to abduct her shoulders to about 90 degrees and then tell her to resist me pressing it down, or tell her to her thumb facing up or facing down. If she's having pain while doing this, that means the test is positive. Then also, I can also ask her to extend the impingement test, that she abduct her shoulder from around 60 to 120 degrees if she has pain while doing that. Then to check for the infraspinatus, I will tell her to put her elbows by her side. Then I will now tell her to flex the elbow and then now external rotate the the forearm against resistance. If she can't do this, or if it's not equal on both sides, that means it's possible that the infrascapular is infraspinatus is injured. So to check for the subscapularis, I will do the Gribet's lift up test. So I will ask her to internally rotate her hand and use the torso of her hand to touch her back, and then I will ask her to lift it off her back. So I will note the extent that she can do it and compare both left and right to see if it is deficient. Then to check for the teres minor, I will ask her I will do the on blowers test. I will ask her to abduct the hand to the 90 degree, and then with our elbow flex and facing forward, and then I'll tell her to try to internally rotate the hand against resistance. If there is weakness, that may show that there is an injury to the teres minor on that side. Then I'll ask her to check for neovascular bundle at the hand notes, and then also check over the radial ulnar and medial nerve, and also check over the axillary nerve to be sure that there is no loss of sensation in these areas. Then check the distal pulses on both the radial and the ulnar pulses, and then I will ask her to do to press to check for wiggling of the scapula, to check if there is injury to the long thoracic nerve, to see if she has wiggling on that side. What else do I need to check? Okay.
Yes.
Then after doing that, I will thank him.
Yes, we'll thank.
I will thank her. I will thank her, and then tell her to dress up, assist her to dress up, wash my hands. Ma.
Good. We took your time and 5 seconds are left. Okay, you can start presenting your case now.
Okay, so I've examined Mrs. Tina, that presented with 15 hours history of right shoulder pain. There is no deformity over the right shoulder, but she has tenderness around the rotator cuff muscle over her right elbow. No differential warmth. The empty can sign and the impingement test were positive. The range of motion on a passive range of motion, active range of motion is reduced on the right compared to the left, and the distal neovascular bundles are intact.
Good. And to complete your examination, what would you do?
Yes, to complete my examination, I would like to examine the cervical spine and also examine our shoulder.
And neurovascular examination.
And then neurovascular examination of the upper limb.
Okay. So what are your differential diagnoses for this patient?
My differential diagnosis for this patient are supraspinatus, rotator cuff injury involving the supraspinatus.
Yes.
Then it could also be due to right shoulder strain involving the ligaments around the elbow, around the shoulder.
What is the management option that you can offer this patient?
For the management, I want to do investigation to confirm my diagnosis. I want to do plain radiograph of the right shoulder, anterior, posterior, and lateral views, and also magnetic resonance imaging of the shoulder. That will show the better soft tissue injury involving the rotator cuff muscle around the
imaging. Can you confirm the impingement of shoulder joint?
The MRI, ma.
Good. So what should be the treatment that you can offer to the patient?
The treatment includes you need to rest her shoulder, then analgesics, and then usually about 3 to 6 weeks should be fine, ma.
Okay. Anything else?
Then
you can
give her broad down sling, then she'll start gradual physiotherapy later.
Yes.
Then if there is complete tear of the tendon, she may need surgical repair through arthroscopic, ma.
Good.